Hi friends, we are live now. I'm Himanshu, welcoming you to today's show on behalf of Zydus Hospitals. Let's start right away. So here you see Madonna. Everyone knows, no introduction required. Amitabh Bachchan, again, everybody knows. Shakira, everybody knows better. Dwayne Johnson, Bhuvneshwar Kumar, and Bolsonaro, the popular man from Brazil. Now, what is common amongst all these people? One, they're famous, rich, they enjoy a celebrity status. There is one more thing which not many of you would know. And I'm going to tell you that they also have a medical connect. What is that medical connect, which is common amongst all of them, is hernia surgery. So obviously, no points for guessing. Today's topic is about hernia. And I have with me today Dr. Vishal Soni, my good friend, and a hernia enthusiast. I'm sure all these guys whom we just mentioned about got their hernia surgeries done. I'm not sure if the surgeon was as smart as Dr. Vishal. Welcome to the show, Dr. Vishal.
Thank you.
So the stage is yours. We'll start right away.
Yes,
I'll start
thank you.
with the first question, and then maybe you can explain a bit about yourself if you want to, and take on the question, so I don't disturb in between. So what exactly is this growth or bulge which is termed as hernia?
Yeah, sure. We would be in the next few minutes talking about the topic, of course. But I must thank Himanshu that you pulled out some amazing list of celebrities who had this disease. This seemingly innocent and a very easy disease, but as in next few minutes we would come to know that when it is not taken care of in the right time and when it is neglected, it can cause a lot of trouble, right? Uh, Going ahead, I would say that hernia, right, the topic of the day and the hero of the movie today, is a bulge or the lump that you rightly mentioned. So it happens when the organ and the covering of the organ, these two things are taken into consideration. So think of my fist as the organ and the other hand as the covering that organs are wrapped inside our body. For some reason, when the covering has a defect or develops some weakness and the organ literally pops out of it. So this popping out of an organ is what we technically call as a hernia, right? To make things a little more simple, think of the abdomen as a room that you're sitting in right now, okay? And when you lie down, the layer in the front, the anterior abdomen wall, is the roof of the room. If that roof for any reason develops a hole, a defect, or it breaks down, that condition is what we call as a hernia. And once that happens, the content of the room or the fist, as I just showed, it pops out and it's no longer contained in the cavity. This condition is what we medically come across as a hernia. Now, when it comes to the community or when it comes to the people, if I have to give an example of, for example, cardiovascular diseases that we commonly come across, or we come across patients with cancer, right? There is a natural inclination of taking these illnesses in a very serious way, because patients, they, of course, they know that these are very serious conditions and they can be dangerous. Unfortunately, in spite of hernia having the potential to be a very nasty disease, in spite of the fact that hernia can also land the patients in deep trouble, somehow the hernia is still not taken very seriously. So we come across our patients in OPD which would say, oh, yes, 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 I've had a small hernia since some time before it started paining very badly. Or when our patients, we see them in emergency, would tell us, મને આ હર્નિયા ઘણા સમયથી હતું, મને ડોક્ટરે કીધું તું કાંઈ કરાવવાનું, but I decided to not do it at that time. And now my intestines are obstructed, or so on and so forth. So patients do seem to take it lightly and then land in a soup, come to us with complications, and that is when things can get really bad. Nonetheless, we know what to do. We would try to teach you today to how to pick up these things a little early so that it can be a smooth journey rather than a rocky affair. Now,
Very importantly, what you mentioned,
yes.
Dr. Vishal, sorry to interrupt, but I'm just reiterating one small fact that understanding your body is extremely important. There are certain signals that your body will give you which should not be ignored. So it's not just about your heart, but it's not just about your brain, or if you have a disease like cancer, but hernia as well. I mean, we can always wait for the emergency to arrive before we reach the doctor.
True. Himanshu, moving ahead, the next extension to the knowledge would be we know we just talked about hernia, what exactly should be or it is. There are types of hernia that we come across. Now, primary hernias, as the family name is, when they occur de novo. And then there are other groups of hernia which we call as incisional hernias. So, incisional hernias typically would happen when there is a patient which has undergone some surgery in the past, some procedure, the muscles have got breached and the things start popping out of that new defect that has happened. And the other ones that I mentioned, the primary hernias. Now, the hernia would be termed as per the location from where it starts. The commonest hernias that we as surgeons would come across would be groin hernias or the genital hernias. Okay, they occur in the area of your groin, commonly called as the indirect or the direct variety of the inguinal hernias or the femoral hernias. The other region which is very common to get hernia would be the navel of the patient, that is the umbilical or the para-umbilical hernias. Other regions would be anywhere in the midline, which is broadly called as the ventral hernia, somewhere near the ribs, which would be subcostal hernia, somewhere near the spine would be lumbar hernias, spigelian hernias, so on and so forth. The list is literally endless. Any muscle, whenever it gets weakened, the intra-abdominal pressure is such that it will try and push out the contents through the defect or through the weakness, and the hernia occurs. So these are the types of hernias that we come across.
One thing that you mentioned, that people often tend to ignore hernias. Now, in India especially, or the developing world, obviously going to the doctor is the last resort, right? That's what people would not like to. Now, what do you suggest as a surgeon is the right time for someone to visit and meet a specialist if they sense that this could possibly be hernia?
Correct. Now, to deconstruct this thing, let's go a step behind and understand what can be hernia, right? So, the commonest symptoms that one should be aware of is a lump or a bulge at that local site. So, as I said, the commonest area where one may develop hernia would be the groins and the navels, and so on and so forth. The initial symptom can be a lump or a bulge that initially can be pushed back inside, but later on keeps on increasing in size, might or might not have pain to start with, and this is the start point of hernia. We know that this can be your hernia. Pain can be an early symptom or can be a late symptom. Early pain, we know, can be because of the muscles that are now getting stretched, can be because of the intestinal contents or the other organs that are getting pushed out, and there is a dragging kind of pain. Later on, however, when the hernia becomes big in size, this pain can actually be sign of a complication. For example, what we call as an obstructed hernia or a strangulated hernia. These also present with pain and a lump. They may have some redness at the site of hernia, and this is a sinister thing. Uh, the post-operative or the outcomes of these patients may or may not be as easy or as smooth as when it happens when there is no complications. There is one more point that I would like to highlight is in patients with obesity or overweight, not only these patients are known to develop hernia more commonly as compared to other people, but the diagnosis is often delayed because the hernias, the small ones especially, are not apparent. Here, the patients have to rely on feeling of the discomfort or the pain, which might be the only clue in the initial period. and a surgeon needs to examine these patients thoroughly to make sure that this is not a hernia. Coming to your question, what is the ideal time to visit a doctor? I believe the instance you feel or you believe that there is something wrong with your tummy and there's a bulge or there is a lump, you should see a doctor. You should see a surgeon and let him or her say that whether this is a hernia or any other illness. So the answer is as early as possible.
Great. So don't avoid if you see any of the symptoms that Dr. Vishal has just cited. Now, another question, Dr. Vishal, I'm sure many of the patients would be asking this, what I'm asking you. We all are scared of surgeries, right? We wish that, some magic should happen and the hernia should vanish. So does it happen? Is it possible? Or eventually we have to undergo the surgery?
So hernia is an endpoint of the weakness. So think of that. It's the end of the road. Means you already reached the end of the road. So if you remember the example that I gave, that the roof of your home is already broken. Now, once the roof is broken, there is no going back on that just like that. It cannot be a spontaneous event which would just go back on it on its own. So commonly we get patients who would inquire that what if I start doing yoga, and what if I start building up my muscles now, or what if I lose my weight, the excess weight that I have, would the hernia go away? The answer is no. Once the hernia has happened, there is already a break, there is already a weakness that has got established. From there on, the only thing that will happen is that the hernia will keep on increasing in size. There is no vanishing of a hernia. Hernia is like this beautiful tattoo that you've already got. And unless you really do something about it, the tattoo is not going away anywhere. It's there with you.
So all those who have a tattoo would know it better, how easy it is to get rid of. I mean, especially those where we are talking about the permanent ones. Thank you, Dr. Vishal. That was very important information for all of us, at least. Now, many of you, I wish you don't have hernias, but again, it's not in our hands. When I gave you the list of people, those who can get hernia, we are no one. We also can get hernia. So in case you have it, you need to look out for symptoms and make sure you do not delay visiting the doctor. That's not going to help. As he said, it's the end of the road. So the roof is broken and you need a surgeon to mend this roof. It can't be mended by anyone else. So my last question of the day to you, what are the options available to patients who are seeking hernia treatment? What is that you would offer to them as your patients?
Yes. So once we know that a patient does have hernia, unfortunately, we would want to know why did the hernia happen in the first place. So if there are any triggering factors, so any respiratory issues, any urine issues, or any other issues in the abdomen that needs some attention or some correction. So the journey starts from there. The journey starts from how do you make sure that all the variables have been taken care of. The next would be whether this is an emergency surgery or this can be pushed away to a later date after better optimization of the patient. And when the D-Day arrives and when the decision is supposed to be taken, we want to make sure if we can ensure that patient can get minimally invasive surgery in the form of laparoscopic or a robotic repair, or we need to do an open repair for the patient, which would be best for him. And of course, there are non-mesh repair options as well. So suture and non-mesh repairs are the other options available for the patients.
That was very informative. So you've at least given us the details in a nutshell. So friends, today's session will be ending now. This is all that we have for today, but Dr. Vishal is going to be with us soon. Again, with next session, we are going to talk about prevention strategy and what are the different treatment options depending on the location, the size of the hernia that we are going to discuss. Thank you very much for joining us. We request you to write to us if you have any questions. We'll be glad to respond to them. And please do share our sessions, join our social media network, and be updated. Thank you, Dr. Vishal. Thanks a lot.
Thank you. Thank you. Have a great weekend ahead. Bye-bye.